Pediatric injury and subsequent treatment experiences can be distressing, challenging, and often frightening for children and for parents. Acute post-traumatic stress reactions are common in the early aftermath of injury, and while most children do well with time and support from their family and with sensitive care from the healthcare team, a large body of research over more than a decade has found that a significant minority, about 1 in 6, will develop persistent, ongoing post-traumatic stress symptoms that still bother them many months later. In addition to the impact on emotional well-being and social and academic functioning, there's strong evidence that post-traumatic stress symptoms after injury can impact a child's physical health outcomes and their health-related quality of life. Trauma-informed pediatric care means keeping traumatic stress in mind while providing care for ill or injured children, and delivering that care in a way that is likely to reduce the persistence or severity of post-traumatic stress reactions in children and in their parents. What this looks like in practice includes minimizing potentially traumatic aspects of the medical care itself, addressing distress, promoting emotional support, and remembering the needs and reactions of the child's family. Trauma-informed care can be embedded within ongoing medical and nursing care of the injured child. So what do we know about the current status of trauma-informed care for injured children? At the institutional level, a recent national survey indicated that systematic incorporation of these practices is far from the norm in U.S. trauma centers that see children. And several past studies have found variable knowledge and practice among emergency and primary care providers. In the current study, our team wanted to better understand the current state of knowledge and practice among frontline pediatric trauma nurses. We surveyed 232 nurses in 5 Level 1 or 2 pediatric trauma centers. Survey participants had a wide range of years of experience. About half had more than 5 years' experience working in an acute care trauma unit. The survey addressed knowledge and opinions about trauma-informed care, nurses' self-rated competence and their recent practice of several specific aspects of trauma-informed care, and perceived barriers to its implementation. The survey results indicate that many nurses are knowledgeable about potential psychosocial impact for their injured patients, and they have favorable attitudes about incorporating attention to psychosocial aspects of injury and treatment within their nursing care. Most nurses reported feeling somewhat competent in a range of trauma-informed practices, like avoiding or altering situations in the hospital that a child or family might experience as traumatic, or eliciting details about a traumatic event from a child or family without re-traumatizing them. When asked about specific practices they may have performed in the past 6 months, more than 3/4 reported teaching a parent or child ways to manage pain or anxiety during procedures, and encouraging parents to make use of their support system of family and friends. However, far fewer nurses reported directly assessing emotional distress or helping parents and children manage difficult and upsetting experiences. These results suggest very good news about the level of knowledge, interest, and basic skills and competence that pediatric trauma nurses bring to the practice of trauma-informed care. And the results also suggest some gaps in current practice that might be addressed via training and policy efforts. As part of our center's work with the National Child Traumatic Stress Network, we've developed a set of tools and materials that can help healthcare teams implement a trauma-informed approach. The centerpiece of these tools is the DEF protocol, developed based on the research evidence supporting trauma-informed care. DEF offers a simple way for nurses and healthcare teams to remember distress, emotional support, and the family as key elements of trauma-informed care. More information, including research summaries, patient education handouts, and free online CE training for nurses, is available at the healthcaretoolbox.org website.